I am Dr. Sridhar. I am an endocrinologist. I am an MBBS and MD from Madras Medical College and DM Endocrinology from All India Institute, New Delhi. And I have about 32 years experience in practice. I'm practicing basically endocrinology and diabetes. But today, our topic is about hypertension and understanding hypertension. So, what is hypertension and how to prevent it? Generally, everybody wants to have a normal blood pressure. So what does this mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates a pressure in the walls of the blood vessel, and this is called blood pressure. And normally, in healthy individuals, it rises and falls throughout the day. But if this blood pressure remains high for a longer period of time and left untreated, then it can lead to serious health complications. In general, persistent high blood pressure is known as hypertension. And this doesn't develop overnight, it develops over time. And usually it can be triggered by unhealthy lifestyle choices, such as leading a sedentary life without much physical activity, obesity, smoking, alcohol consumption, stress, etc. Besides this, there are several other risk factors. Number one is the age. And as people get older, the arteries can stiffen up and narrow, and excess fat can build up. Having a family history of high blood pressure, one or close family members may have high blood pressure, our chance is more. Excess salt intake. The more the intake of salt, more the chance of blood pressure. Not eating enough foods with potassium can increase the blood pressure, risk of stroke, and CKD or chronic kidney disease. Eating processed and fatty foods increase throughout the body, make the body work harder, push the blood throughout the body harder, and cause blood pressure to rise. On the other hand, lack of physical activity can cause also further blood pressure. One more important factor is stress, and reacting to stress in unhealthy ways can also increase blood pressure. Moving on, hypertension does not have any accurate symptom or sign. So just measuring blood pressure is very important. And we measure what is known as the systolic blood pressure, which indicates the pressure when the heart contracts, and the diastolic blood pressure when the heart relaxes. Most of the time, the blood pressure will be asymptomatic, and one tends to ignore it. That's why it's called a silent killer. But there can be symptoms like headaches, tiredness, visual changes, buzzing in the ears, fatigue, nausea, or vomiting. But majority of the times, it does not have any symptoms, and that's the reason why it's always referred to as a silent killer. Why? Because it can lead to this most important cause of stroke, kidney failure, eye damage, heart attacks, blindness, etc. So how do we diagnose blood pressure? By measuring it. And the instrument which is used to measure it is known as the sphygmomanometer. And a normal healthy blood pressure is taken with the patient sitting and relaxed in the left upper limb. and it's 120 by 80 millimeters of mercury. If the pressure, however, exceeds 140 by 90 millimeters of mercury persistently on 2 readings, then that person is said to have high blood pressure or hypertension. Last month, that is on 17th of May, we celebrated the World Hypertension Day. This is a day which is dedicated to highlight the importance of monitoring blood pressure and bringing global awareness to the 1 billion people who are living with blood pressure worldwide. And the theme of this year's World Hypertension Day is measure your blood pressure, control it, and live longer. And so the important thing is controlling the blood pressure if elevated. How do we do this? The important thing is to maintain a regular lifestyle by active exercises for at least 30 minutes per day, at least 5 days a week. That is 1 of aerobic exercises. Healthy diet, abstinence from smoking and alcohol intake, stress management, and regular blood pressure management. This alone is not enough. There may be situations where many of us require medications. And once the medication is prescribed, regular adherence to the medication is important. Now, I've told you about exercise. Besides this, we should maintain a healthy diet, what is known as a DASH diet, that is dietary advice to stop hypertension. And here, there is less salt, less saturated fat and total fat. Less salt means less sodium, avoiding alcohol, and getting plenty of potassium. And this diet should be rich in whole grains, fruits, vegetables, low-fat dairy products. And even a small reduction of sodium in the diet can reduce the blood pressure by 5 to 6 millimeters of mercury. And so hereafter, look at food labels and eat lesser processed food, and don't please add extra salt. If you are smoking, stop smoking immediately and keep checking your blood pressure regularly by home blood pressure monitoring. Important things by doing stress management, like listening to music, doing yoga, focusing on something calm and peaceful, and indulging in regular meditation will make stress management easy. And as I told you, now many patients require medications. And once medications is prescribed, please make sure you're adhering to it so that you can lead a healthy life and manage your blood pressure properly and be devoid of dangerous complications like stroke, heart attacks, kidney failure, blindness, etc., etc. I thank you all for a patient listening.